How are you people? Welcome to Doctors of Medicine. I'm Gonzache Zibwa, a medical student in USEC. So today we're gonna talk about the thorax, whereby we're gonna mainly focus about the osteology of the thorax. So this is our overview here. We're gonna talk about the sternum, where we're going to say that the sternum is divided into three parts: the manubrium, the body of the sternum, the xiphoid process. We're going to talk about the ribs, the true ribs, false ribs, floating ribs, typical ribs, atypical ribs. We're also going to talk about the joints here: the manubriosternal joint, the xiphoidsternal joint, the costochondral joint, and the chondrosternal joints. Right, so let us get into it. Starting from the sternum. Now, the sternum has three parts, like I've said. We have the manubrium. The manubrium has four articulation sites. So the first one here, we have the clavicular notch. The clavicular notch, it will articulate with the proximal end of the clavicle. And then we have another articulating site here that will articulate with the first costal cartilage of the first rib. And then we have the third articulation site where it articulates with the superior part of the second costal cartilage. And then at the lower part of the manubrium, it will articulate with the body of the sternum, forming what you call sternal ankle. Sternal ankle. The sternal ankle can also be referred to as the manubriosternal joint or the angle of Lewis. Now, so this is for the manubrium of the sternum, and then we go to the body of the sternum. Now, the body of the sternum, it will articulate laterally with ribs from number 2 to number 7. The costal cartilages of rib number 2 to number 7. Yes. And posterior to the thoracic vertebrae T number 5, T number 6, up to T number 8. Alright. The sternal angle here, we also need to take note of it. It is anterior to the lower border of the T4. Lower border of the T4. And then we have the jugular notch here. The jugular notch, it is anterior to the lower border of T1. The lower border of T1. Yes. So, and then we have the xiphoid process. The xiphoid process, superiorly, it will articulate with the lower border, or with the lower part of the body of the sternum, forming the xiphoidsternal joint. The xiphoidsternal joint is anterior to the lower border of T9. T9 vertebrae, thoracic vertebrae number 9. Yes. So let's go to the ribs. We have three classes of ribs. First, I'm going to talk about these classes: the true ribs, false ribs, floating ribs. So, the true ribs, these are ribs from 1 to 7. These, they directly articulate with the sternum via their costal cartilages. Yes. And then we have false ribs. False ribs. These are ribs from 8 to 10. They indirectly articulates with the sternum, whereby they join the costal cartilage of rib number 7 to articulate to the sternum. And then we have floating ribs. These, they do not attach the sternum, but rather their costal cartilages, they are suspended in the abdominal musculature. Yes. And then these three classes, they are further divided into typical ribs and atypical ribs. So I'm going to talk about typical ribs here. As we can see, maybe this is rib 5. Rib 5. Now, so typical ribs, they range from rib number 2 to rib number 9. Rib number 2 to rib number 9, you together. So this is the structure of a typical rib. So a rib is these essential parts that you need to take note of. We have the head of the rib that will articulate with the vertebrae. We have the neck, which is the constricted part, right? And then we have the tubercle that will articulate with the transverse process of the corresponding vertebrae. And then the rib has a body. We have a body. Now, the body, at the superior aspect of the body, it is round. It is round and smooth. At the inferior aspect of the body, it is sharp. It is sharp. Now, so the point where the rib curves towards the anterior aspect of the body, we say it's an angle. And this point is the weakest part of the rib. This is the weakest part of the rib. You need to take note of that. So, at the inferior border, we also have a groove, what we call the costal groove, that accompanies the vein, which is the vein, the artery, and the nerve, moving from superior to inferior. We start with the vein, and we go to the artery, and then we go to the nerve. So that's something that we need to take note of about the typical ribs, right? And one of the most important things, the typical rib, they have two articles. They have one head, but two demifacets. The lower facet is larger than the upper facet. The lower facet, it will articulate with the corresponding vertebrae, and then the upper demifacet will articulate with the superior or the upper vertebrae. Alright, you need to take note of that as well. So let's say this is a rib number 5. So rib number 5 will articulate with the thoracic vertebrae number 5, as well with superiorly to articulate with the thoracic vertebrae number 4. Alright, so this is typical ribs. These are typical ribs. Right, now we go to atypical. Atypical ribs. Atypical ribs, we have rib number 1, rib number 10, rib number 11, rib number 12. So you just have to get them. You have to know them. Now, we are going to start with the rib number 1. And I'm just going to explain a little bit about rib number 10, 11, and 12. Right. The most difference between atypical and typical is on the facets of the head. Atypical ribs, they have 4 facets. Why? Because they articulate to one vertebra. Whereas typical rib, they have 2 demifacets. They articulate with the 2 vertebrae. Right. So, this is the facet. So, rib number 1 will articulate with T1, which is thoracic vertebra number 1. So, there's something that is essential, that is important about rib number 1. Rib number 1 is the widest rib. Widest rib, right? You need to get it that it's the widest rib, as well, and also it has sharp edges or borders. It has no costal groove. So typical rib, they have costal groove, but the atypical ribs, they have no costal grooves. And then we go to rib number 10, rib number 11, and rib number 12. These ribs, they have no tubercle. That's the main difference. They have no articulating tubercle. Where's the rib number 1? Yes, we have the tubercle. But rib number 10, 11, and 12, we have no articulating tubercle. Yes. And one of the most, they are essential things that pass through, let me say, superior to the upper border of the first rib. We have the subclavian vein that will pass superior to rib number 1, and then we have the subclavian artery, and then the vein and the artery is separated by a anterior scalenus muscle. So you find it that on the rib, on the first rib, we have grooves. So the subclavian vein groove, right? It will accommodate the subclavian vein that is anterior to the anterior scalenus muscle, and then the subclavian artery groove, it will accommodate the subclavian artery, which is posterior to the anterior scalenus muscle. So basically, that's all about the ribs. Now we are going to the joints. We have joints that are associated with the sternum. We have 2 joints. We have the manubriosternal joint, like I said before, the sternal, that gives the sternal ankle. And then we have the sternal joint. So the manubriosternal joint, it is a joint between the manubrium and the sternum. Manubrio sternum. So we are just joining those two words. So the mandibulo-sternal joint is a cartilaginous joint. Simple. It's a cartilaginous joint. The xiphisternal joint, xiphoid process, and the body of the sternum is also a cartilaginous joint. So all joints that are associated with the sternum, they are cartilaginous joints. Now, we have what we call costochondral joints. Costochondral joints. Costochondral joints are, we have what we call costal cartilage, and then we have a rib. So the costochondral joint is between the costal means rib, chondral means cartilage. So the joint between the cartilage and the rib. So these ribs, they are also cartilaginous joints. They are also cartilaginous joints. All of them, they are all cartilaginous joints. And then we go to chondrosternal joints. Chondrosternal joints, these are joints between the lateral border of the sternum and the costal cartilages. So you have to know that these chondrosternal joints, they are synovial joints, except the first chondrosternal joints of the first costal cartilage. It's a cartilaginous joint. So basically, we have described the anatomy of the thorax, where we mentioned about the sternum, the ribs, and the joints. So for our next lecture series, we are going to talk about the intercostal space, because we have ribs, and between the ribs there are intercostal space. So you need to watch that video. Thank you.